great. We had this giant influx of money. Lots of that spending was given for nurses, but now what? Now that money is drying up, right? We don't have that money to work with anymore. So remember, hospitals are also business. They have their profit margins. They have their quarterly goals to meet. So if you want a properly functioning hospital, you have to be able to generate some kind of profit, not just revenue, but some kind of profit, because lots of times people don't want to invest in something that isn't going to generate them some kind of revenue. So with less government funding means they have to cut costs somewhere. And the first place you're going to cut costs is most likely the nurses, the actual staffing, because nurses don't really bring in any kind of hospital revenue. Physicians, surgeons, those kind of people have their patients. They're the ones that bring in the revenue. So nurses are kind of always getting cut off. Same with CNAs, respiratory therapists. They're one of the highest costs that the hospital has to be burdened by. You could say, I want to say nurses are a burden, but if you're looking from a financial business standpoint, nurses and other healthcare professionals in that realm are a financial, you could say, burden to these places, unfortunately. So hospitals are now having less money to work with. I also looked at some of the numbers, and according to macrotrends, hospitals' profit margins are the lowest they have been seen since 2016. So the 2023, roughly the profit so far that the hospitals are generating on average is about 2.3, 2.4%, which, like I said, it's as low as they've been since 2016, but they are definitely in an uptrend compared to the last couple of quarters of 2022. It's definitely trending back up, so you might slowly see a surge in prices for travel contracts, probably in the upcoming winter. Lower profit margins, less money to go around. They don't want to spend it if they don't have to. Like I said, they have to satisfy their initial investors.